Hello everyone, my name is Marian Conder, and today I will be presenting my evidence-based practice project, Improving Glycemic Control Through Diabetes Self-Management Education and Support for Adults with Type 2 Diabetes. Type 2 diabetes mellitus is a significant public health concern that affects millions of Americans and is associated with serious complications including cardiovascular disease, kidney disease, neuropathy, and decreased quality of life. Many patients struggle with self-management behaviors such as medication adherence, healthy eating, physical activity, and blood glucose monitoring. As a result, many patients continue to have those elevated hemoglobin A1C levels despite treatment. The purpose of this project is to evaluate whether participating in the diabetes self-management education and support, also known as DSMEs, can improve diabetes self-management behaviors and reduce hemoglobin A1C levels in adults with uncontrolled type 2 diabetes. My target population consists of adults with type 2 diabetes who have uncontrolled blood glucose levels, as demonstrated by those elevated hemoglobin A1C values. These patients are typically identified during the routine primary care visits through lab results, provider assessments, and patient reports of the difficulty managing their diabetes. The theoretical framework selected for this project is the health belief model. This model suggests that patients are more likely to engage in health promoting behaviors when they recognize their susceptibility to complications, that they understand the seriousness of the condition, and that they believe the intervention will be beneficial and feel confident in their ability to make changes. DSMES supports each of these concepts by providing education, skill development, and self-management support. 3 research studies were used to support the proposed intervention. The first study by Chowdhury and colleagues from 2024 was a systemic review and meta-analysis that demonstrated improvements in the glycemic control among adults who participated in diabetes self-management education programs. The second study by Allah and colleagues from 2023 was a randomized controlled trial that found DSMES improved both hemoglobin A1C levels and diabetes-related distress among adults with type 2 diabetes. The third study by Moss and colleagues from 2022 was a qualitative study that explored barriers and facilitators to diabetes self-management from the perspectives of both patient and healthcare providers. The findings emphasized the importance of individualized education and ongoing support. Based on this evidence, the proposed intervention is referral to and participating in diabetes self-management education and support program. The implementation plan begins with identifying eligible patients during routine primary care visits. Patients with elevated hemoglobin A1C levels will be referred to this education DSMES services. Baseline hemoglobin A1C measurements will be obtained, and patients will participate in the diabetes education focused on nutrition, medicine management, physical activity, glucose monitoring, and healthy coping strategies. Patients will receive ongoing support throughout the intervention period. Follow-ups visits will occur to assess progress, reinforcement of the education, and to address barriers to self-management. The primary outcome measure for this project is hemoglobin A1C. This lab level of the hemoglobin A1C is an effective measure because it reflects the average blood glucose over approximately a 3-month period. Baseline hemoglobin A1C values will be compared with follow-up hemoglobin A1C values after participation in this diabetes education program, the DSMES. Secondary outcomes include improved medication adherence, increased self-management confidence, improved self-care behaviors, and increased participation in diabetes education activities. The timeline for this project begins with patient identification and baseline assessments, followed by the DSMEs, participation, and ongoing support. Outcome evaluation occurs approximately 3 months after implementation using repeat hemoglobin A1C testing and assessment of self-management behaviors. The anticipated outcome of this project is the improved glycemic control and enhanced diabetes self-management among adults with type 2 diabetes by increasing access to the DSMEs and supporting patient engagement, healthcare providers may help reduce complications and improve long-term health outcomes. Thank you for taking the time to review my presentation. I appreciate your attention and welcome any questions or feedback. Thank you.